Hi, I'm Rose Hayden with Hunt Regional Healthcare, and today I'm with Jenni Baker, a registered nurse with Hunt Regional Home Care, and we're talking about home health. Jenni, thank you for joining me today. I really appreciate it.
Thank you for having me.
Sure, and let's jump right in. So what is home health?
So home health care is health care at home. Patients who have been in the hospital who are sick, have gotten a little better, they're ready to leave the hospital but maybe not well enough to take care of themselves independently at home and just need a little bit extra help, maybe some skilled nursing. So we provide that quality home health with professionals at home for things such as IV antibiotics, wound care. We also provide physical therapy, so if the patient needs some extra help with mobility, some strengthening, if they've had some weakness and they just need some strengthening at home. Maybe occupational therapy, help with activities of daily living, getting in and out of the shower, getting up and down out of a chair, maybe some speech therapy if they've had a stroke and they are having some difficulty with swallowing or speaking or memory issues. We provide those things in the home, so they're in the comfort of their own home, they're with their own surroundings, they are in their daily routine, and this helps the patient, and so that's what we're there for.
So you mentioned somebody who had a stroke. What are the other things that might happen to somebody? Who else needs home health?
So maybe patients that have had surgery, if they've had a joint replacement and they need some physical therapy at home before they're ready to get out of the house and go to outpatient physical therapy. Patients who have new disease processes that maybe they need some education on those disease processes, such as congestive heart failure. If they're taking new medications and we need to be in the home to monitor those meds and see how they're responding to those. So those are some of the things that patients would need home health for.
Okay, so you mentioned stroke, you mentioned joint replacement, you mentioned as well new diagnosis, and other things would be like accidents, or what about if they're having some cognitive challenges or maybe just changes in their behavior? Is that something you address as well?
Yes, that's something we can help with as well. And something I didn't mention was wound care. We do a lot of wound care in the home with things such as wound vacs or maybe some diabetic wounds that patients have. And so we work with the doctors and the doctor's orders, and then we go in and take care of those wounds and get them healed.
Okay. Now, you said we, so who does visit the patient? What types of professions?
So we have several. We have skilled nurses, we have registered nurses and LVNs that go into the home. The RN is the one who would initiate or start care in the home. So we have doctor's orders. We go in, we evaluate that patient for what the skilled need is going to be, and then we develop a plan of care based on what the doctors are wanting us to do. And then we also have physical therapists that go into the home again and help with things like mobility and strengthening and gait training, walking.
Gait would be like steps, right?
Yes,
okay.
Like the way that they walk,
okay.
Making sure they're doing that the right way. If they're having to use an assistive device, they're trained on how to do that properly so that it's safe.
Walkers or cane or something new to them,
yes,
right?
Absolutely.
Okay.
Yes. So, and again, occupational therapy for activities of daily living, taking showers, getting in and out of a car. They practice that so that when they're ready and they're independent enough, they can go to outpatient therapy if they need to. Speech therapy. We also have home health aides that can go into the home to provide safe personal care. They assist the patients with bathing and teach them safe ways of doing that so that we can prevent falls. And then we also have social workers who can go into the home and help with things such as durable medical equipment, which would be things such as walkers and canes, wheelchairs, transfer benches, shower chairs, things like that. They can also help with assisting patients with financial needs and getting set up on programs in the community that they might need. And then we also have resources to help with like diabetic education,
great,
nutritional needs and things like that.
Wonderful, wonderful. And so are the families of these patients included as well?
Most definitely. We need the family's help. When we go into the home, a lot of times the family or caregivers are present with the start of care. We go over all that information with them. We teach them things about the patient's disease processes. We teach them how to administer medications. We teach them how to perform wound care if it's something simple enough where the doctor's comfortable with the family taking care of that. And we also teach them how to administer medications through IVs. So they're very involved in the patient care. They help us a lot, and we're there to guide them and to teach them until they feel comfortable and independent with their health management.
Okay, so how long does home health last?
It varies depending on the patient's individual needs. It can be a few weeks to months. We just always try to make sure that we're meeting the goals that are set for the patient. So as long as the patient needs us, we will be there. But the goal is always for them to be independent with their health care. So if we can get them to that point and they meet their goals, then we're ready to discharge, which means they're ready to take care of themselves. And so we get them ready for that.
Oh, good news. Now, are these services paid for by Medicare and other insurances?
Most of the time they are. Most healthcare insurances do cover home health services, which is a great benefit to the patient. There are certain criteria usually that need to be met, such as the patient being homebound, which means that it's a taxing effort for them to leave their home. And because of that, then the insurance company pays for us to come in and help take care of them. The goal is for the patient maybe not to have to go to the hospital or not to have to go to the emergency room. And so that's what we're there to try to prevent.
Wonderful. And are these services, do you need a referral from a physician? So they're needing to have a referral from a physician to have these services?
Yes, that's how we start care, is that we have to have a referral, whether it's from the hospital or the doctor's office, but we do need that referral and that home health order, and then we can then contact the insurance company and verify their benefits and see what they cover, and then we go from there.
Wonderful. Well, that is a lot of information and very good. I know we all have questions about home health, and I really appreciate your time today, Jenny. Thank you so much.
Sure, thank you for having me. I really appreciate it.
This video has been brought to you by GEUS 34. GEUS is your community-owned provider for electric, internet, cable TV, and true local programming.